Good morning from Miami Beach. This is Dr. John Bennett broadcasting for Neurosurgical TV. We have Sri Lanka Neurosurgery Grand Rounds run by Sarath Munya Singhe, a neurosurgeon from Sri Lanka, and I'll turn it over to him. Welcome.
Thank you, John. So, thank you, and I would like to welcome you all to Neurosurgery TV on behalf of Neurosurgery TV, Sri Lankan Grand Rounds. So, first of all, I would like to thank all these panelists. We have got a distinguished panel on your neurosurgical training system. So, yeah, it's all to you, right?
Yeah, can you see my slides?
Yes, we can.
All right. Thank you very much, Dr. Surath and Dr. John from Neurosurgical TV. And as discussed earlier, that curriculum in each country is same, almost same, because the way we train our residents, they are same, but the system might be different. So it's a very nice topic chosen to see how we practice, how we train our residents in this part of the world. So this is the current scenario of doctors in our country, in Nepal. From the data, 31st December 2020, we have about 28,000 doctors. Total number of doctors is 28,000. And this is the number of specialists in our country. It's around 8,000, out of which around 1,000 are surgeons, general surgeons. If we, this is how the neurosurgery in our country started. First neurosurgical procedure was performed during 1960s when Dr. Gongul, who is a general surgeon, and he started doing neurosurgery at the start of 1960s. I remember the case was subtemporal decompression of one of the tumor. And then later on, Professor U.P. Devkota, who was FRCS in neurosurgery, first trained neurosurgeon, who established a unit, neurosurgery unit in 1980s. And later on, he established it as a National Neurosurgical Referral Center in 1998. And he is the one who started this neurosurgical training, MCH, in neurosurgery from 2000. So now we are around 92 neurosurgeons in Nepal. And you see the number, majority, out of this 92, 33 has MCH in neurosurgery. Majority of neurosurgeons in Nepal has MS neurosurgery degree, and they are trained from Pakistan, Bangladesh, and China. Majority of these neurosurgeons. We have 5 FCPS trained neurosurgeons and 1 FRCS, and we have two neurosurgeons who had diplomas and trainings in the past. Out of these 33 MCH neurosurgery, 31 was reproduced and produced in Nepal itself, and 2 are from India. So there are 3 universities in Nepal who runs these training programs. One is National Academy of Medical Sciences, Bir Hospital, where I work. And another is Tribhuvan University, Triveni University, and third one is Kathmandu University. So after the National Academy of Medical Sciences, this Triveni University, we started MCH programs, and now we have Kathmandu University running MCH program in their two institutions. Altogether, we have about more than 24 of hospitals who provides neurological services in the country. Out of them, the number of neurosurgeons and the number of hospitals, majority of them, more than 60%, they are located in the capital, Kathmandu itself. But fortunately now we have neurological services available all over the world. We have Nepalese Society of Neurosurgeons, which was established in 2008. And under the umbrella of this Nation Society, what society does it advises almost all the institutions and different hospitals to participate in academic activities, to do some kind of seminars, etc. And now, under the umbrella of this Nepalese Society of Neurosurgeons, now we already have two chapters. One is vascular chapter and spine chapter. So this is the upcoming conference of Nepalese Society of Neurosurgeons, and there is going to be an international conference of Nepalese Society of Neurosurgeons with and second interim meeting of Asian Australasian Society of Neurosurgeons in November 2021. So how our curriculum looks like in Nepal is almost same, I guess. So the goal is to master basic and specialized neurosurgical techniques, to familiarize with the modern advances in neurosurgery and related fields, and definitely to create an independent and qualified neurosurgeon capable responsibility for neurosurgical care upon completion of the course. The objectives are, they have three basic components. One, provide neurological services. Number two, do the researches. You have to do the researches. And third is, you have to educate yourself with the time, and you have to train the upcomers, new students. So overall, it's to train and educate so as to produce a neurosurgeon who possesses at least minimum standard at par with prevalent standards in the developed world. These are the specific objectives. I mean, the specific objectives, like all these candidates must know basics anatomy, physiology. They must know all this neuro radiology, neuro-ophthalmo, neuro-otology, and they must know all this head about not only head, it's the spine, peripheral system, etc. This is the admission criteria in Nepal. All these students, they are qualified only after having degree of Master of Surgery, MS in General Surgery. And there are few universities, even they want 1 year experience after MS in General Surgery, 1 year of experience, and then they will be able to apply for the MCH in Neurosurgery. And the degree should be recognized by the university or academy and Nepal Medical Council. And the candidate should pass postgraduate entrance examination conducted by university, securing at least 50% marks. And the entrance examination, all it is MCQs. And selection will be as per the merit list. The candidate, once selected, must sign a contract to attend the entire duration of course on full-time basis. The candidate will not be allowed to do private outside practice during this period. Candidate registered for the course should agree not to enter other academy university programs until the completion of the course. And the candidate should agree to abide by the rules and regulations of the academy. or else may be expelled from the course on disciplinary ground, and the candidate should undergo medical examinations prior to admission. Duration of the course is 3 years, and this is MCS Neurosurgery course degree. So the course is, so the structures covered in this curriculum is definitely all aspect of neurosurgery, neurology, neuroradiology, neuropathology, neuroanesthesiology, research, and thesis preparation. In the past, we used to send our residents in not only in different departments in our academy, but in different institutions. But now with the advancement in neurosurgery, with the availability of all the technologies, advanced technology in the countries, usually our residents have rotations in our countries only. But we always encourage all our residents to go in the Europe or in the United States or in other part to see how the neurosurgery are there. They at least residents should know it's not only one hospital-based practice. They should go to the other center, see how other people also does the neurosurgery. So this is the outline of the topics. I like in the basics, it's anatomy, physiology, and its clinical applications. And then introduction to neurological surgery, oncology, vascular, epilepsy, functional neurosurgery, pain, pediatrics, peripheral nerves, radiation therapy, radiosurgery, spine, trauma. So all the chapter which we have written in all the textbook of neurosurgery, they need to know all this. So this is the scheduled procedure the residents should know according to their year or performance. So like in first year resident, they should do at least 100 clinical history taking, 50 pre and post-operative management, setting of ICPs, management of ventilated patients, lumbar puncture, lumbar drain, etc., etc. In second year, they continues with the procedure which they learned in the first year, perform cerebral angiography, craniotomy for intradural hematoma, flaps for tumors, VP shunts, laminectomies, introduction to microneurosurgery, and in each year, they have to write one paper at least. In the final year, they should be able to do this microneurosurgery, tumor surgery, lumbar and cervical disc surgery, spinal fixation, peripheral nerve surgery, meningocele repair, etc. It has to be level 4 or level 5. Either they should perform it independently or under direct supervision. So at the end of the training, they should be able to know this good surgical technique. They should be able to teach the juniors. They should have few research activities, and they should be good in communication. So final competency, these are the recommended procedures to be done either independently or under indirect supervision, level 4 or 5, before the summative evaluation, like aneurysm, so AVM. So this is the minimum procedure they must do it. And publish one paper in national or international arena every year, and present one paper in national or international conference every year. This is mandatory. So these are the recommended textbook for the residents. And we have very strict academic regulations about the postings, like emergency duties or elective scheduled theaters, like leave, how much they should take, OPD's days, everything is very strictly controlled. How we evaluate the resident at the end? So the examination consists of like paper 1, it's all applied basic science, MCQ 40 and SAQ 60. And part 2 is principle and practice of neurosurgery. Again, MCQ 60% and 60% is SAQ. And third paper is recent advances in neurosurgery and subspecialty. Theory paper will be always, it's a 3 hours, and the pass mark, it's a bit different. Like in my academy, at least 50% in each paper and minimum overall 50%. But in other institute like Triveni University, they have 60% in each paper and 60% overall. And regarding clinical, practical, and viva, it's total 300 marks. Clinical, practical 150, viva and OSCE 150. For this, pass marks at least 60% in clinical, practical, and 50% in OSCE and viva with minimal overall 50%. And candidates should pass in both theory and clinical, practical independently. So there are many things need to be looked after now. See, with the advancement of technology, like see in curriculum first year, resident had need to raise the flap only for trauma cases. In second year, they can raise the flaps for tumors, etc. But see, now you have navigation. Since from the first year residency program, they use all these advancement techniques like intraoperative scan, navigation. So I think this is time we are thinking to modify and change our curriculum a little bit. So all this MCS program, it's the basis is MS in general surgery. So only post MS general surgery, anyone can apply for neurosurgery. It's we are working on having, direct MCH neurosurgery course after MBBS, which will consist 5 years of intense neurosurgical training and 1 year of junior consultant training. And now we will have a common entrance exam, and we are planning to have inter-university posting, which is not done yet. And we are soon starting fellowship in subspecialties. Like there are spine people are very much interested in spine subspecialties fellowships. So like we are planning 1 year fellowship in this subspecialty for neurosurgeons in spine. And if an orthopedic surgeon wants to do fellowship in spine, our criteria, it's 2 years of training piece. This is a photo, I took it 2 days ago. So this is our final year residents, and I can see that these residents are nicely, confidently, independently, they perform this endoscopic pituitary surgeries. And this is what training should be. Thank you very much.
Okay, Sarath.
Right. I think it was a very comprehensive introduction and a summary of regarding your training system and the curriculum. So thank you very much. So I will get back to you with 3 questions, and on the second round we'll discuss about the positives and the negatives or the drawbacks in your system as well. So next, shall we move?
Good afternoon.
Good afternoon to all the colleagues all around the world.
Okay, Sarath, you want to give them instructions?
Right. Okay, Mian. Hi, I'm Sarath here. Nice to meet you.
Nice to meet you too.
Right. Okay. So can we start from your presentation? I hope you are ready with the presentation. Or we just need an introduction of your training system. As we discussed, we need to get to know how you produce the neurosurgeon. After your candidate completes the internship. So how do you produce a neurosurgeon, and your education and your curriculum? So let's have an introduction on your country's neurosurgical training system. Right, so over to you.
Are you talking to me?
Yes.
Yes, of course. Yeah.
Okay. First of all, I would like to thanks my colleague, especially in Sri Lanka, who has invited me for on this prestigious platform. First of all, I want to introduce myself. My name is Dr. Mia Vass. I am working as a consultant neurosurgeon and a fellow of pediatric neurosurgery in one of the largest and biggest hospital in Pakistan, the Children Hospital and the Institute of Child Health, Lahore. Uh, it is an honor for me to have a talk with all my respected colleagues on this platform. As you know, neurosurgery in Pakistan is making progress day by day, although we are facing a number of challenges due to economic crisis here in Pakistan. The neurosurgery in Pakistan is not so far as much advanced as in other countries like in Europe and in States. But for the last 10 years, we are now making a greater progress in the field of neurosurgery. Hello?
Yes, we can hear.
Acha, okay. So for the last 10 years, Pakistan is moving forward in neurosurgery education and training of our residents. We have a comprehensive and structured residency program in neurosurgery, which is almost a 5-year degree program. In Pakistan, we have two types of neurosurgery training and education, which the universities are offering in Pakistan. One of it is Master of Neurosurgery, which most of the universities all over the Pakistan are conducting and doing. And other is CPSP program, which is a College of Physicians and Surgeons of Pakistan, known as FCPS in neurosurgery. Both the programs are very comprehensive and structured residency and training program in Pakistan, which is almost of 5 years, including first 2 years in general surgery training and then 3 years in respective neurosurgery training and education. In Pakistan, we have a very structured and compromised education system in especially in medical field. After doing MBBS, you have to appear an entrance test before entering into the neurosurgery training program. 1 year after doing 1 year house job, you have to appear an entrance exam, which is conducted throughout the country for the residents who are wishing to appear or pursuing their career in neurosurgery. First 2 years, they are doing their training and residency in general neurosurgery, and after 2 years, they are shifted to their respective specialist neurosurgery platform and neurosurgery units. The neurosurgery training in Pakistan is now making a good progress. In the last 10 years, we have make it a very structured and comprehensive training program for our residents throughout the country. After 2 years of doing general neurosurgery, there is a intermediate exam. We evaluate our residents and trainees after 2 years in general surgery. Then they are shifted to their respective neurosurgery training program. In Pakistan, the neurosurgery training is both clinical and as well as research work. We have to do clinical and research both in neurosurgery. Every resident, there is a must to write a synopsis and then a dissertation in research in the field of neurosurgery. Without doing synopsis and dissertation, no candidate can appear in the exam in Pakistan. It is a clinical and research both. We are teaching our residents and trainees in both fields in clinical and as well as in research field. So it is a compulsion for every resident to do and write a synopsis and then a dissertation. And at the end of the exam, after the exit of the final exam, they have to defend their dissertation, which is called defense of their thesis or dissertation. After clearing their dissertation, they can get their degree in the respective neurosurgery field. Neurosurgery in Pakistan for the last 10 years is making a good progress in this field. We have now developed a post-residency fellowships program for our trainees and residents. So after getting their primary degree in neurosurgery, they can be offered fellowships program in different supra specialties in neurosurgery like pediatric neurosurgery, spine neurosurgery, and the stereotactic and functional neurosurgery in Pakistan. I am nowadays working in Children Hospital, which is the biggest children hospital in Pakistan. This institute is offering a fellowship in pediatric neurosurgery all over the residents of neurosurgeons in Pakistan. In spite of pediatric neurosurgery, we have developed a structured program in spinal surgery as well. A fellowship after getting their primary degree in neurosurgery, they can get a fellowship in spine surgery for almost 1 to 2 years. Some institutes offer 1 year program and some institutes offer a 2 year program after residence after completing their primary degree in neurosurgery. As I have told, we have two specialist degree in neurosurgery in Pakistan. One is called Masters in Neurosurgery, like in India, Nepal, and Bangladesh. And other is a College of Physicians and Surgeons of Pakistan's FCPS in neurosurgery. Pakistan Society of Neurosurgery is established almost 20 to 25 years back in Pakistan, which included all over the Pakistan, all the provinces and all the neurosurgeons who have completed and pursuing their careers in neurosurgery. They are the member and the part of this Pakistan Society of Neurosurgery. This Pakistan Society of Neurosurgery is working day and night for the betterment, improvement, for the structured and training program to uplift this neurosurgery residency in Pakistan and the post residency fellowships in Pakistan. Although we are not so much uh, comprehensive and structured like other countries like UK, America, and other European states, but for the last decade, Pakistan is making a good progress in this field of neurosurgery. Pakistan Society of Neurosurgeons, they are arranging annual conferences, hands-on training program, annual workshops, and international collaboration with other institutions, with other respective colleagues, so that the neurosurgeons in Pakistan can get maximum chance and maximum hands-on training in their subspecialties in neurosurgery all over the world. We have a collaboration with Korea, Japan. Most of our neurosurgeons are working across the country in states, in British as well. They are also contributing to their neurosurgery training in Pakistan, and Pakistan Society of Neurosurgery is continuously in touch with these international neurosurgeons so that we can uplift this further. We can uplift this program further in Pakistan. The purpose of the annual conferences, hands-on training, international workshops, international collaboration is that if we can teach and train our younger neurosurgeons so that they can play an important part in this society. And we have a deep and connections with all over the neurosurgeons all over the world. Pakistan Society of Neurosurgeon, as you know, the big names in Pakistan in neurosurgery like Professor Salman Sharif, Professor Naveed Ashraf, Professor Atar Inam from the Aga Khan University Hospital, they are doing their part and they are working day and night to the betterment of the neurosurgery training in Pakistan. The institutions which are most famous in the neurosurgery training in Pakistan, Pakistan Institute of Neurosciences, which is present in Lahore, Aga Khan University Hospital, Shifa International Hospital, no doubt Children Hospital in making is playing their part in children's, and Lanka University Hospital, Karachi. We have a deep connection and association with different international organizations of neurosurgeons in all over the country, like World Federation of Neurosurgeons, International Society of Pediatric Neurosurgery, and North American Spine Association, and other different association which are offering different fellowships, different training programs to the international neurosurgeons, young neurosurgeons, and of course with Korea and Japan as well. Many of our residents and students are working in Korea and Japan and getting their spinal fellowships from there. As you know, the situation of pandemic for the last 1 year, which has affected the neurosurgery training and its education for the last 1.5 years. As you know, due to the COVID, we have not proper big elective lists. We have reduced our rounds to the short rounds. Number of residents which are doing elective surgeries, they are reduced to a minimum number. So the international conferences, international workshops, international training programs, they are all affected due to this pandemic, the COVID situation in Pakistan. Uh, as you know, Pakistan is very much better in handling the situation of COVID, but not so advanced that they have eliminated and all the COVID cases. We have now started vaccination program with the help of our brotherly country, China. They have provided vaccination to the Pakistan. So all the health workers, frontline health workers in Pakistan are getting vaccinated for the last 10 to 20 days. I think the COVID has affected the neurosurgery training a lot because the residents and the student who are their final year of residency and training, who needs maximum exposure to the elective lists, elective rounds, and discussion, conferences, and international collaboration, they are very much suffered due to this COVID situation, especially the students who are there in last year training of their residency. But I hope due to the availability and the start of the this vaccination process, we are uh, we are hoping to resume the all international activities, and all activities in the Pakistan will be resumed uh, in coming days. I think the role of Zoom throughout this pandemic situation is excellent. It is a blessing in the COVID situation because with the help of Zoom, we can have relation with international communities, international colleagues. We have Zoom meetings, webinars, and other education material and stuff uh, we are getting from the Zoom meetings, Zoom's webinars, and the neurosurgeons almost who don't have much time to travel to other countries and international workshops. The Zoom has played a very vital role in this situation. We can get maximum benefit at our homes through this app. It is a good platform for the exchange of ideas, exchange of views, and the exchange of knowledge through the international community and the international colleagues throughout the world. At the end, I hope the situation will be under control after the discovery of this vaccine, and we are hoping to resume all the international activities like conferences and hands-on training for the young and the upcoming uh, students and the upcoming residents. They can get the same era of period before the start of this COVID. At the end, I would like to thank to my colleagues who has invited me to on this platform. Sorry, I one thing I can't mention here. The international community and the neurosurgeons in the South Asia, we should make a platform for our residents, for our future neurosurgeons, so that we can exchange our residents and neurosurgeons in these South Asian countries, so that they can get maximum exposure in international community. In Pakistan, the Pakistani neurosurgeons, they are hoping and wishing there should be a platform which can offer them to the fellowships, so that they can also get a maximum international hands-on experience from their colleagues, what they are doing in their countries and in their respective units. So we should make a platform of South Asian community, so that we can exchange our residents and offer fellowships to the international neurosurgeons, international community. It could help and create a great harmony between these uh, brotherly countries around the Pakistan. At the end, I would like to thank to my colleagues, especially Dr. Surad, who has invited me and give me a chance to speak on this platform. Thank you. Thank you.
All right. Thank you. Thank you very much, Mian. So it was a good presentation regarding your country's neurosurgical training, and thank you for your views and the information. I think we have connected Dr. Sudhir back. I think there was some problem with the connection, so I think
let's try it. Let's try it.
Yeah.
Hello?
Yes.
Can you hear me?
Yeah, that's much better.
Okay, okay. All right, thank you everyone for this opportunity, and good evening from India. I am Sudhir Ambekar. I am a consultant neurosurgeon at Jaslok Hospital in Mumbai. And I would like to give a brief about the neurosurgical training options in India, and what are all the ways in which one can get trained in India. So essentially, there are two main paths to training in neurosurgery in India. One is the DNB, the Diplomate of National Board course, and the other is an MCH course. So one of the two, both the boards have approved accredited training courses in India across various centers, and one can choose either to go through the MCH course or the DNB course, ultimately resulting in getting accredited and trained in neurosurgery. The other option in so either of the two, both the courses have a 3-year path to neurosurgery, in which one trains in general surgery after medical school training and then goes on to train in neurosurgery, or one can choose to directly train in neurosurgery with a 6-year course right after the medical school. There are these two paths wherein one can choose to start with general surgery for 3 years and then go on to do neurosurgery, or directly 6-year course in neurosurgery after the medical school. There are a number of government as well as private institutions which offer neurosurgical training in India. There is a strict guideline and curriculum as outlined by the Neurological Society of India, the NSI, which is the apex body which controls neurosurgical training, as well as uh, conducts regular courses and teaching sessions for all the residents and young neurosurgeons in the beginning of their career. Upon completion, during the neurosurgical training in India, there are strict guidelines as to what is expected from the residents all along their residency, right from starting with management of the patients in the ward and in emergency, to doing basic bedside procedures such as a lumbar puncture or external ventricular drainage, and then graduating slowly onto trauma surgery and ultimately onto microneurosurgery. Because of the advances in neurosurgery, the field has expanded so much that training in every aspect of neurosurgery may not be possible for every resident in every course. But yes, it has been made sure that at least the resident gets the basic training in every subspecialty of neurosurgery throughout the course. And following the residency, usually neurosurgeons can choose to go pursue subspecialty training in their field of interest, by either working in a clinical unit which specializes in a particular aspect of neurosurgery, or doing formal fellowship trainings in India or abroad. We have a number of subspecialty trained neurosurgeons in India who have been trained in India and abroad, either in the United States or Canada, Australia, Korea, and various other institutions across the world, Japan. Hello. Yeah.
Yeah, we can
Yes,
hear you.
yes,
Yeah.
we can hear.
Yeah. So at the end of the 3-year or 6-year training program, all the residents have to clear the board exam. The board exam usually consists of written exam followed by clinical exam, in which various clinical aspects of neurosurgery, right from clinical examination to decision making to radiology, and sometimes in a few institutions, even the operative techniques are examined, and operative techniques are examined, and then the person, only after he or she clears the board exam, is licensed to practice in that particular state. And whenever, yeah, so I think that's about it. There are a number of, I can go into details of the institutions, the central government institutions and the other institutions, but I think it is an unending story. So overall, usually these are the two main ways in which one can pursue neurosurgery in India. And I think we can learn more about or discuss more about neurosurgical training in India as we go ahead in the webinar.
Great. Okay. Thank you very much, Dr. Sudhir. So I do neurosurgical training in Sri Lanka. Right. So first of all, I need to tell you that I'm not a trainer yet, so I am not involved in decision making. So it's a neutral and unbiased comment. So only comments and suggestions I make, and no criticism. Right. So the specialty board in neurosurgery is the specialty board under the Board of Study in Surgery, which is responsible for the training and the assessment of trainees selecting a career in neurosurgery. So we have one eligibility criteria to enter the training program, only one. So candidates who are successful at the MD surgery examination are eligible to apply. Right. So for example, if I start with a candidate who leaves the medical school and who completes 1 year of internship, and then at the end of the medical school, I mean, when he leaves the medical school, there is a final exam, final MBBS exam, and according to the merit, he will be given a position, a post, what we call the post internship as a medical officer, whichever the part in the country. So then he has to spend 1 year, at least 1 year of post internship as a medical officer before he sits the selection exam. So if you want to enter neurosurgery, you had to do selection exams in surgery, which is called initially, which was called MS Part 1 exam or the MD selection exam. And then once you get through that, you become a resident, a registrar in surgery. So the residence life, it's almost 3.5 years, which includes 1 year of general surgery and then rotation in surgical subspecialties, including neurosurgery. So it's almost 42 months of training with general surgery and other subspecialties, including neurosurgery. And at the end of these 42 months, you have another exam called MD Surgery Part 2 exam. I would say it's a relatively difficult exam, and it's mainly on general surgery and other subspecialties, including neurosurgery, but it's not pure neurosurgery. And then at the end of this exam, according to the merit, you can select neurosurgery as a subspecialty, right? And then you become a senior resident in neurosurgery. So you have to have a 2 years local training as a senior resident in neurosurgery. So it's pure neurosurgery. And then you finish your local training at the end of these 2 years. And then you had to find out an overseas job, which is equivalent to a resident. So we had to find it. Some people will help you, some may not. And in our country, we have mandatory overseas training. I think that's a major difference when we compare to the other countries in South Asia. So it's mandatory, either in UK or Australasia, either Australia or New Zealand for 2 years. And once you finish this training, overseas training, you had to come back at the end of the 2 years. And then you had to have a pre-board certification assessment, and then board certification, a procedure board certification. You will have a viva, and you will have an assessment by the board of neurosurgeons. So then you become a board certified neurosurgeon. So roughly, it takes around 8 years after becoming a postgraduate, theoretically, minimum of 8 years. So once you complete the internship, it takes around 10 years for you to produce a neurosurgeon. For example, if you take me, I completed my internship in 2009, and I became a board certified neurosurgeon in 2019. So it's almost 10 years, and I got through all my exams on the first attempt. So it's at least 9 years. So these are the record maintenance you need to keep as a trainee. So you need to maintain all these as a resident, operative logbooks. It's similar everywhere: surgery in training assessment and research project leading to dissertation, right? So something about dissertation or thesis. So these are the guidelines. So you have to, under the generic guidance of the PGIM. So it has to be a publication of the research finding as an original full paper, or you have to submit a detailed project report to the board of study. And then we have the 6 monthly surgery in training assessment for a trainee. And as a trainee, they need to attend these academic meetings, conferences, workshops, a minimum of 2 per year. Maintain the logbook, as I said, and the monitoring progress is mainly assessed by the surgery in training assessment by the trainer. And you have to have at least a level 3 or level 4 assessment to make it eligible for you to complete your training successfully. So that is during the local training. And then once you become an overseas trainee, the Board of Neurosurgery should receive confidential assessment reports from the trainers from the overseas every 6 months. And also there is something called multi-source feedback system of the Postgraduate Institute of Medicine. And then once you come back after your successful completion of your overseas training, then there is something called this eligibility for the pre-board certification assessment. So you should be eligible. So these are the eligibility criteria: satisfactory completion of the local training program, satisfactory completion of the overseas training program. Then we have to accept the progress reports and these in-training assessment reports, and you have to submit the portfolio, including the logbook. And then you have to accept this dissertation and complete this multi-source feedback cycles from the PGIM. So this is a summary of the pre-board certification assessment, how it works. So the assessment shall be based on the portfolio assessment and a PBCA viva. So you have to submit your portfolio beforehand, and then you will have a pre-board certification assessment viva in the form of an oral presentation. So this is the structure of the portfolio and the content. So it contains, it has 7 contents: subject expertise, teaching, research and audit, ethics and medical legal issues, IT, lifelong learning and reflective practice. So subject expertise, mainly the progress reports from the supervisors, their feedback on communication skills and the log of procedures, operative logbook, any assessments at the workplace, and teaching, undergraduates, postgraduates, ancillary health staff like nursing officers and communication skills. This is research and audit, the research papers published, accepted for publications, oral presentation at conferences and audits. And also there's a component called ethics and IT, which is continuous medical education, CME, training programs, workshops, etc., and lifelong learning, again, conferences and meetings, and reflective practice, where you narrate at least one learning event experienced when you are during your training overseas. Right. So this is the format of the BBC evaluation. So this is how they do the marking, right? So the portfolio assessment and the viva. And you become a board certified neurosurgeon afterwards. So that's basically regarding how we produce a neurosurgeon in our country. Right. Okay. And give me 1 second. Am I sharing the screen, John? Or?
No, you're off the screen share now. Okay.
Right. Okay. So that's basically a summary of how you produce a neurosurgeon in our country, starting from starting as a intern. Right. So if we cannot connect Dr. Asul, can we connect Dr. Asul? Is he still there?
Let me see. I don't think so. He was in the OR, correct?
Yeah.
No,
okay.
I don't believe he does. That's okay. We can get him some other time.
Of course, right. So then for the second round, then we'll go ahead and discuss regarding the positives and negatives in our system. So I would like to start from the drawbacks in my country. So then we'll continue the discussion with the other panelists. Okay. And a few questions directed at each panelist. Okay, right. So when we talk about the positives in our system, so I would say it's a streamlined and uniform system. So only one way of becoming a neurosurgeon, only one pathway. So you get through your MS, general surgical MS, and then you enter the neurosurgical scheme and you become a neurosurgeon. And clear instructions covering almost all the aspects. If you go through the web, you have this neurosurgery prospectus. So it has given clear instructions. So it's clear and theoretically well-defined curriculum, including the basic sciences, theoretically. But when it comes to practice, there are few issues. So I will tell you in the next few minutes. and satisfactory assessment system we have, especially this surgical in training assessment. And we have a mandatory overseas training, as I mentioned earlier, which is non-mandated in other countries. I mean, according to my knowledge with the discussion we had. And so it's a good thing. So we can have up-to-date technology, especially in the countries like UK. So we know Sri Lanka is still a developing country. So it's the facilities are not that great everywhere. So it's a good opportunity for the trainees. And satisfactory caseload for the training purposes, which is a good advantage. So we have a lot of cases and we have very less neurosurgeons, as I mentioned in my last webinar. Also, we only have around 27 neurosurgeons for the whole country, which is a very, I mean, very limited amount. So less trainees means you have a big caseload. So you have a lot of work. So good hand skills. You can make a skilled neurosurgeon if your training system is good, right? So these are the positives. Very shortly, very briefly, I'm mentioning. And when you talk about the negatives, right? So as this is as per my experience and the other colleagues' experience, and as a neutral observer, as I mentioned you, I'm not a trainer or I'm not involved in decision making, so I'm not biased. So the main deficiency I observe is, I mean, such a waste of time for subject expertise that you are not going to practice as a neurosurgeon. For example, why you need 1 year of general surgery, 6 months of orthopedic surgery, and again 6 months in general surgery in the periphery, 2 months of cardiothoracic, 2 months of urology, 2 months of vascular surgery to become a neurosurgeon, right? So we need pure neurosurgeons, not 1/3 general surgeons or 2/3 neurosurgeons, right? You spend 42 months almost before initiating pure neurosurgery. Instead, teach them neuroanatomy, neurophysiology, neuroradiology, neuropathology, research methodology, right? Neurocritical care, etc., etc. So out of that 3.5 years, cut off 2 years, I think 1.5 years for general surgery and its subspecialties is more than enough. So rest of the 2 years we can use to teach them these subspecialties, I mean, basic sciences related to neurosurgery, like neuroradiology, as I mentioned earlier. So then we can make it's pure neurosurgical for 4 years as a local trainee and further 2 years in overseas training and a total of 6 years, a total of 7.5 years with that 1.5 years. So we can make a fantastic, training system and you can produce a fantastic trainee, neurosurgical trainee with that actually. So, and the other thing, so if we make it like that, so we have 4 years of local training, so you can have a trainee at a certain institution for 2 years, a minimum of 2 years. So there is time for the trainee and the trainer to get to know with each other because it takes time. Neurosurgery, unlike other subspecialties, takes time, right? So a learning curve is maybe a little bit longer than the other subspecialties. Right, so during that time, we can assess them, we can let them observe, we can let them assist in surgery. So you have time for them to, for you to assess them, right? So, because we need theoretical knowledge as well, because you need to know what you cut, right? Because neuroanatomy is very, very important because in neurosurgery, I always say the margin between life and death can be 1 or 2 millimeters sometimes. So it's very important that you have your knowledge before you embark in performing surgeries. Right. The other thing is we had to teach them better attitudes. So we had to make them trainees with better attitudes, which is very important. And then we had to hold a neurosurgical exam, an exam in pure neurosurgery. Which I see in the other countries like India, Pakistan, Nepal. So according to the discussion, I understood that there is a pure neurosurgical exam. So similarly, I think we need to have a pure neurosurgical exam to assess them. So what are the drawbacks for this, right? As I mentioned you earlier, we have very limited manpower. We have only 25 neurosurgeons for the whole country. So So it's difficult sometimes because you do your government service from say 7 a.m. in the morning up to 4 o'clock, and then you go for your private practice, and then you have your personal work, you have your family, so it's less time you can dedicate for these things. But it's not an excuse, right? So we have to have a dedicated team, a highly dedicated team whom can work towards the common agenda. Right, so we need unity. We need to have a common agenda. Then only we can expect the uniformity and high quality. Right, so that's the first deficiency I noted in our system. Right, so and secondly, as I mentioned you, in the curriculum we have mentioned neuroanatomy, neuroradiology, neuropathology, etc., etc. But there is no time allocated or no specific rotation for that. It means that in my time, so I had to learn it myself. So I had to go through the web, so I had to read books, I had to go to the radiologist personally and learn it. But is it acceptable? I think it's not the way, it should not be the way. We had to have, as I said, a specific rotation where it should be taught by the radiologist, by the pathologist, by the anatomist, etc., etc. At least 1 month, maybe 1 or 3 months. I saw in the Bangladesh prospectus, they have 3 months, 3 months duration for the each category for the basic sciences on a rotational basis, which I think a very good training system, very good curriculum. So in our case, so the neurosurgeon, is it the neurosurgeon's responsibility to teach these things to the trainee, or someone else's responsibility, or where is the guidance? So that becomes a problem practically, right? And then the next one regarding the teaching sessions, regarding the time for teaching. So it's a very busy environment, right? A busy setup. We have a lot of cases, less trainees, so the time for teaching is not enough, according to my experience. And I think demonstration of the correct technique of the surgery by the trainer is a must for at least once in a lifetime for a certain surgery. And most of the times we have seen, even myself, we used to learn from the senior house officers, the medical officers in the unit. I know they are trained, they have been there for some time, but is it acceptable? A postgraduate trainee learning from a non-postgraduate doctor, right? So it's a different thing that we can learn from anyone. Even there are things that we need to learn. We can learn from a house officer, but it's a different thing. But this is the beginning of the trainee's career. You have to learn the correct thing, correct technique. So if the things get wrong from the beginning, then who is going to suffer? It's not only you, the patient. So I think there's a question in that again. As I mentioned, we have a very high caseload. So sometimes that we get a lot of casualties. So we are on call, right? So the problems with burnout, right? As Abhishek mentioned, raised his question initially. So we have a lot of crowd clearing. So the time for the academic activities are not very adequate, right? And talking about these journal clubs, MDMs, morning MDMs, right, where you get the trainee to answer questions. I think it's not enough in my experience as well. I don't think even for the trainees at the moment, I don't know whether they have enough exposure to this. I think that this is one area which we need to improve on. I think we need to have at least one teaching session per month, right? Ideally 2 per month, once in every fortnight, right? Then another problem is most of my colleagues say that it's their trainers' personal effort that made their career better rather than the system. So obviously there is some problem with the system according to the trainees' view. Okay, and next one also, I would like to say that the board certification procedure has to be uniform for everyone from A to Z. There should be no delays in getting the board certification for the candidate. And sometimes we see the people are waiting for overseas training for such a long time once they finish their local training. So these are intermediate group of people, which is not going to help to anyone, not to the system and not to the candidate also. I think it's you know, the senior neurosurgeons, trainers' responsibility to actively intervene for this intermediate group and to make them get through whatever the obstacle, whatever the drawback, and get them into the correct pathway and get them, I mean, make them to have their overseas training as early as possible and get them through the correct pathway rather than the other ways. So, and there should be clear regulations for everyone in theory and in practice. That's my opinion. Otherwise, I mean, not only the trainee is going to suffer, and the system also going to suffer one day. And we have to also think why the trainees are not selecting neurosurgery willingly, right? Most of the times we see, I mean, when you once the MD exam is over during the selection, very less amount of trainees want to do neurosurgery. In my time, I was the top in the rank in both the selection exam and the MD the part 2, but I was the only one who selected neurosurgery. Like it's like that most of the time. Only just one candidate wants to do neurosurgery. But we need to think, sit down and think, why is this? Why the trainees are not selecting neurosurgery? There should be a problem in the system, right? So we know that as a third world country, we have very limited infrastructure, very limited resources, right? Most of the times, you know, people get frustrated when you don't have facilities to work there, right? So you do something, you go and learn something, especially when you go overseas, you learn something very hard, but when you come back to your own country, you don't have facilities, you don't have resources to work, so you get frustrated. It's natural for anyone. So there is a limit to the tolerance, right? So there is a limit to their patience. So most of the time we have seen in the past, and it might happen in the future also, so they migrate to a different country. So we had to think, we had to sit down and think about this. Very important. And what about the addressing the psychological aspect of the training, right? So I have gone through the neurosurgical training and the prospectus of all these countries except Nepal. I couldn't find it on the web. But I only found the addressing the psychological aspect only in the Indian guidelines. But I think it's a very important aspect, because I think all the trainees should be treated same, unbiased, right? Should be unbiased, and sometimes we know, you know, things can go wrong. So we have to back them up. We have to address their psychological aspect as well. If anyone can, you know, make mistakes, right? As a trainee, you know, neurosurgery is different. It's difficult, right? So you can make mistakes, right? So you have to have some backup. So your trainer's responsibility to safeguard you, to be mentally support your trainee, right? And finally, we had to respect the trainees' perspective as well. So we should give them a chance to speak in the meetings and express their thoughts, because this is the future of neurosurgery. So that's the future of the country. So it's very important in that sense. So I think these were the drawbacks. So negatives I noted in our system. So as a neutral observer, unbiased observer. So I think the responsible personnel will look into this in future. And regarding changing, you know, the entry criteria, the eligibility criteria through MS, rather than doing general surgery for 3.5 years, I think there were discussions going on to directly get into neurosurgical scheme in a different pathway. Was discussed, but it was not implemented, and hope soon it will be implemented, and it will be beneficial for the betterment of the neurosurgical fraternity in Sri Lanka. So that's all about neurosurgical training and curriculum and its positives and negatives from my point of view. So I would like to give the chance to other speakers as well. So can I connect to Dr. Sudhir from India? So can we have his opinion regarding the negatives and the positives he noted? Hello.
See him on the panel there? See here. Sorry, we were a little disorganized. Do you see him on the panel, Sarat?
I don't think so. Right. Okay.
Yeah.
Anyway, so I think Professor Jha is there. Yeah. So we'll.
Well, I don't know. Warlix, are you there? I don't know if she's here. She's not a planned. Warlix, are you there?
Yes, I'm here.
Warlix, would you mind discussing neurosurgery education in Thailand just a little bit, and what you like about it and what you think needs to be changed?
It's kind of like unexpected conversation that I gonna give today.
No, I know,
Okay,
I
so-
know this is unofficial, it wasn't planned, but just your view.
Oh, my view.
Yeah,
So-
your personal view of your education in neurosurgery in Thailand.
Oh, in Thailand, we have neurosurgeries training programs. I think a long time ago, but right now we separate out from the general surgeons. We separate from the Royal College of General Surgeons of Thailand already. So we kind of like dependent. So that's what I like about it, so
Okay.
that we can manage our own like Royal College. But most of the people who trained in my years are, I think 80 to 90% is still a guy. For talking about, but I don't think it's a problem or it's there is any difference between a gender why I'm training. I'm talking about the neurosurgical training. I think that we improved by we have a system to evaluate such as WFME or some kind of like specific systems to evaluate the residents each year. Like you have to have the certain number of the case that you have to do an operations or the paper exams or the oral exams that you need to pass. Yes.
Okay, very good. Thanks for your take, Borlix. Well, Sarath, do you want to have other comments from panelists?
Right. So I think we can connect to Professor Jha from Nepal.
Thank you. Yeah, thank you, Surat and John. Yeah, there are pros and cons in all the fields, and same applies in our field too. If I talk about the neurosurgery residency program in our country, I see there are so many positive things like the volume they see here in Nepal during their residency is a lot, and now we have many and few hospitals who are highly technically advanced. So from the beginning, when they use these gadgets, I found the level of confidence are high, and so these are the little extra add in their confidence level. And see, we have a post MS General Surgery program. So altogether, it's around seven to 8 years of program. If you include MS in General Surgery, then a year or 2 year of experience as registrar of General Surgery. So there are drawbacks that it is 7 or 8 years program. But if we see again, if someone is once joined after completion of MS in General Surgery, they know, they have extra knowledge of surgery in all the fields. See, in Nepal, where still the specialists are not easily available, like in far mountain areas. So if someone is trained in MS general surgery, then he can not only treat head injury or spine injury, then he can of course treat other injuries, like at least emergency cases like blunt abdominal trauma or some kind of fractures. But again, drawback is it's a little lengthy program. And in our program, I see there is no exchange program between the universities. The number of, though the number of neurosurgeons in our country is not bad. It's around 92 for almost 28 million people. That is for 300,000 population, one neurosurgeon is not bad. But majority of these neurosurgeons are scattered. So in one institute or academy, you will not find adequate number of specialists, trained people. So for example, in my academy, we don't have someone is expert in functional neurosurgery, but I know someone who is expert in functional neurosurgery, but is from other university. So we don't have exchange program between the university or academy. So it is difficult to send them to other institute. So we are trying to build this relationship between the universities. And I think rest is we are very much satisfied with the education system in Nepal. By the end of the course, almost all the neurosurgeons, they are very much safe and capable of doing independent, safe neurosurgery. So, thank you.
Okay. Can I ask a few questions from Professor Jha regarding?
Yes, please.
Right. So, can you tell us now? You said that there are 92 neurosurgeons for the whole country, which is, considering the fact compared to us, it's considerably higher amount of neurosurgeons. So, how is the trend for the trainees to select neurosurgery in your country?
I mean, the volume is increasing every year. But see, in Nepal, we can produce maximum 8 to 12 neurosurgeons per year only. So still there is load. The reason why 50%, almost other 50%, they have to go to the other countries to get the degrees. So we are still lack of the load. We cannot.
Okay. And what about the resources and infrastructure available for the neurosurgery in your country compared to the other subspecialties in surgery or general surgery?
The resources?
Yeah, resources and the infrastructure for the neurosurgical.
Yeah, luckily, few centers, including our academy, we are almost equipped with all the resources. If you talk, we don't have. I mean, we have to send our resident outside the country just for their exposure to like few functional neurosurgery and this radio surgeries. Otherwise, rest of the things we have everything in our country.
Right. So how many hospitals? So how many units are there? Neurosurgical units are there for the whole country?
No, there are, as I showed in my slides, there are 3 universities, and almost 5 institutions. They are running the MCH neurosurgery training programs. Altogether, there are more than 24 of hospitals where neurological services are going, but it's the only five institutions where MCH neurosurgery training being held.
All right. So, and you mentioned in your presentation that for a candidate to be eligible to enter neurosurgical scheme, that you had to get through the MS general surgery. Am I right? So,
Right.
So once you get through this MS surgery, and how long is the neurosurgical training? A total of how many years? Is it 3 years or 4 years?
It's a 3 years.
It's a 3 years. And how many years of training for the general surgical part?
It's a 3 years course, but like there are different between in the universities. There are universities where you can directly apply after MS general surgery, but there are universities who ask 1 year of extra experience as a registrar in that department, and then can apply for neurosurgery.
I'm sorry about that. Okay. There you go. I'm sorry. Excuse me, Sarath, we have 15 minutes. Okay, there are a couple of questions on the board that are general. Do you want to answer them now?
Right. So
there's a couple. There's one that says, "I'm from Tajikistan. How can I have training in India?" It's a pretty general question.
I think I'm not the best one to answer that. I think it has to be the neurosurgeon from India. He just texted me that he had to leave the.
Hello.
Okay. Oh, go ahead.
Hi, Sharath, I'm here.
Right.
Go
I'm
ahead.
here.
Go ahead.
Okay. Okay.
Yeah. So for someone who's for a foreign national to train in India, it depends whether he wants to train. He wants to do a residency in India, or come here for subspecialty or focused training. So if someone wants to have focused training, he or she can directly write to the neurosurgical programs in India or the mentors that he wants to train under, and then depending on and there are two different types of training. One is an observership, the other is a fellowship, clinical fellowship. If someone wants to have hands-on experience, he or she will have to have a temporary license to practice in India, which is not very difficult to get, which can be obtained through the state medical board. If you want to do a residency in India, then I think it is very difficult for a foreign national to come here and do residency. He or she will have to first get his medical school training. If it is done, the person can apply for residency training in India. But I think more commonly what we see are foreign nationals coming here for subspecialty training, and that is not difficult. There is no centralized program or matching program such as a few programs in the North American continent. But one has to directly write to the mentor and who he or she wishes to work under. And
okay, we're having some technical problems there. Let me just go on to the next question. Okay, Sarath, you with me?
Yeah.
Yeah, someone asked, he wants to train in neuro-oncology. How can he organize it? He says he has 6 years experience. I don't know. That's an extra year of training, isn't that, Sarath? Isn't that neuro-oncology? Is that existent in your part of the world?
No. We don't have, we don't have a subspecialized training. We have general neurosurgical training with all these neuro-oncology, neurovascular, everything is there. But we don't have subspecialized training like in UK or in other countries. So we
Okay.
just have general neurosurgery.
So they would have to go to India for that?
Yeah. Right. Right. So if Dr. Sudhir is available, we have got 10 minutes, a few more minutes.
Yeah.
Is it, John?
Yes.
Right. Can I ask two questions from Dr. Sudhir?
Yeah.
Dr. Sudhir, yeah, I think you have
Yes, please.
two pathways to enter the neurosurgical, the career, MS and DNB. According to your
Yes.
opinion, which one is better, you think? Is it MS or DNB?
So ultimately, the degree doesn't matter much. It is what the quality of training that or the institution that you work in.
Yeah.
I think that is what is most important. And so one has to really, if someone wants to apply for residency training in India, whether it is MCH or DNB, one has to really go through the profile of the institution, the previous residents who have trained there, and get some information about where the residents who have graduated from these institutions have been placed. So depending on that, one can. But there is no one. There's no. It's not like this MCH is better or DNB is better. It all depends on the institution that you work in. And most institutions have a standardized curriculum and standardized way of working. I must say that the DNB board is very, very strict and very cautious in its approach. And I, being a DNB faculty myself, I know that they are extremely strict and very methodical about the curriculum and following the uniform curriculum all across India. So the simple answer to your question is there is no one better course. Both the courses are good in their own ways, and it all depends on the institution that one wants to train.
Okay, right. And just one more question. So when I go through your it is neurosurgical prospectus, so this curriculum in the web. So it says, especially mentions that there is some lack of uniformity, and it has to be streamlined. So why is that? Why does it mention? Yeah.
I'm sorry. So here, I may have unmuted you mistakenly. Hold on.
Okay, I got it.
Okay, got it.
Yeah.
Okay, sorry
Hello.
about that.
Yeah. So
Yeah.
no problem. So the reason why there is still work that needs to be done is the hospitals in metropolitan cities have much more infrastructure than the hospitals in level 2 or level 3 cities or in rural areas. So that is why, although both these hospitals may have neurosurgical residency programs, the standard may not be met in some institutions, which is why there is still work that needs to be done in infrastructure in various institutions that offer neurosurgical training. So that is where work needs to be done. So there are many such things, and the good thing is that the Neurological Society of India, which is the apex body, has recognized these lacunae and is actively working towards eliminating these.
Right. Okay. Do you have subspecialty training there also, or is just the general neurosurgical training with which includes the subspecialties?
So we have subspecialty training in almost all the subspecialties, such as functional, cerebrovascular, pediatric, endoscopy, spine. We have subspecialty training, although it's not standardized again, and the duration of these training programs also varies from institution to institution. So although we have fellowship training programs in subspecialties, they are not standardized, and there is no specific guideline as to the requirements for subspecialty training. The FNB, that is the Fellow of National Board Examination, that's a part of the DNB. FNB has come up with some guidelines, but not all institutions that offer fellowship training are registered as FNB course. So there is a lot of work that needs. It's not organized very well, but yes, there are options for subspecialty training in all the aspects of neurosurgery.
Okay, thank you very much, Dr. Sudhi. Thank you very much for your time and for your comments. That's all from my end. John, do you have any questions? I think we're running out of time, is it?
I believe Manu Cheddar has a question or comment. You want to say something? Manu Cheddar, am I pronouncing your name right? Hello, Manu, are you there? I can't hear you. You're muted. Go ahead. Go ahead. Oh, well, that's a young neurosurgeon. The neurosurgeons are getting younger. Okay. Okay. Well, that's a comedy interlude there.
No.
Let me, how do I get you off the screen? Yeah, okay, I don't know why I can't get you off the screen. Yeah, okay. Yeah, hi, how you doing? You had that question about the oncology, right?
Yes, yes.
Did you answer that? Was it answered for you?
I want to have training in neuro-oncology because in our country, only 2 or 3 our teacher can do it in Tajikistan.
Yeah, I believe Sarath answered that. He said that you'd have to go to India, right, Sarath?
Yeah, I think it's in Sri Lanka, we don't accept from candidates from other countries.
Yeah, India is the place to look. But keep in touch with the community. You can get answers and you can meet people that can, the internet's a good place to meet people for neuro-oncology possibilities. So, okay, Sarath, I guess we have to wrap it up soon.
Yeah, right. So
anything else you want to do? Anything else?
No, I think that's it from my end. I think it's time to wind up. So thank you very much for all the panelists for connecting and to making this webinar success. So unfortunately, we had few hiccups. We had problems with connections, and we couldn't get hold of the Bangladeshi panelist. I think he must have gone for an emergency surgery, so I couldn't contact him. So that's how it goes. So anyway, so thank you very much, John, for giving us this opportunity, as well as all the panelists, Dr. Sudhir from India, Dr. Professor Jha from Nepal, and Mian from Pakistan, and also Professor Rasul from Bangladesh, even though we couldn't connect him today. We'll try next day. So thank you all.
Okay, Sarath, thanks for putting all the work into getting it together. We're going to get better. There are glitches. That's okay. We're learning. We're like interns, residents in video. We're just in training. And thanks everyone else for coming. We have another webcast in 30 minutes on artificial intelligence, and you're all welcome to come. So let me put that information on there on the screen there. Let's see here. Maybe. Okay, that's not it. Just give me a second here. I can't believe I can't believe I can't get it. Okay, here we go. Here we go. Here we go. Okay, it's at 30 minutes with a PhD from Buffalo. He's we're doing research in the interface of artificial intelligence and neurosurgery. So that could be interesting. Anyways, we'll wrap this up. And anything you want to do in the future, Sarat, just let us know. Okay.
Of course. Right. Yeah.
Okay. Goodbye, everybody.
Goodbye. Thank you.